A colonoscope is the tool used to perform a colonoscopy. It is a thin, flexible tube with a light and video camera on the end. The colonoscope can usually be used to enter the very end of the small bowel, known as the terminal ileum. The front tip also has a light, a channel for water irrigation, a channel for air and water, as well as an instrument channel. Special tools such as tiny forceps or wired loops or snares can be passed through the colonoscope to remove polyps and take samples called biopsy of suspicious tissue in order to look for signs of cancer. You will be offered a sedative to help you relax during your colonoscopy, and you will be placed on your side for the procedure. The colonoscope bends, so your doctor can move it around the curves of your colon.
During the entire procedure, a magnified, high-definition video from the colonoscope plays on a monitor in real time, so your doctor can thoroughly examine the lining of your colon.
A small amount of air may be blown into your colon to help expand the passageway so that your doctor can see better. The colonoscope is then slowly pulled out while your doctor carefully examines the inside of your bowel. Polyps are usually not cancerous, but they can change into cancer, and that's why they need to be removed.
The most common removal technique is called snare polypectomy, where the polyp is surrounded by a wire loop and then an electric current in the wire burns off the polyp.
Other methods are available depending on the size and shape of the polyp. After your colonoscopy, you will be taken to rest in a recovery room until the effects of your sedation wear off. Because of the sedation used during the procedure, you will need a family member or a close friend to drive you home. Before you go home, your doctor will share the results of the colonoscopy with you. Colon cancer is one of the most common cancers worldwide, and while it often develops silently, there are warning signs your body may give you. When caught in its early stages, colon cancer is highly treatable, with survival rates dramatically increasing. In this script, we'll uncover the 8 most common warning signs of colon cancer. One of the earliest and most common signs of colon cancer is a noticeable change in your bowel habits.
These changes may indicate a blockage or narrowing in the colon caused by a tumor.
Seeing blood in your stool is always a red flag. Blood in the stool is a potential sign of colon cancer, as tumors in the colon can bleed. However, you should never assume it's something minor. Only a healthcare provider can determine the cause. This discomfort may feel like bloating, gas, or a constant ache in your stomach area. If abdominal pain becomes frequent, severe, or doesn't resolve with typical treatments, it's essential to seek medical attention.
Cancer cells consume a significant amount of your body's energy, and the disease can also interfere with your body's ability to absorb nutrients from food.
While there are many reasons for weight loss, experiencing it without any changes to your diet or exercise routine is a signal that something might be wrong. This isn't the kind of fatigue that a good night's sleep can fix. It's a deep, persistent exhaustion that doesn't go away. Anemia can leave you feeling drained, lightheaded, and unable to focus. This sensation, known as tenesmus, can be caused by a tumor in the rectum or lower part of the colon. If this feeling becomes persistent, it's worth discussing with a doctor. Colon cancer can cause blockages in the digestive tract, leading to trapped gas, bloating, and a sense of fullness even after eating small amounts. Bright red blood or discharge coming from the rectum is another warning sign of colon cancer. However, any form of rectal bleeding, especially if it persists, should be evaluated by a healthcare provider. The risk of colon cancer increases after age 50. Diet. A diet high in red and processed meats and low in fiber is linked to an increased risk. Hint,